Hey folks, Dr. Jeff Williams, Creekstone Integrated Care, right here in Amarillo, Texas. I want to welcome you to part 3 of the series we've been doing called Can Disc Herniations Actually Be Worse Than the MRI Shows? Now my question, as stated in part 1 and part 2 of the series, is if a low back or lumbar disc is 4 millimeters herniated while laying down in an MRI tube, what happens when the patient sits up and becomes weight bearing? Will the herniation increase or will it be affected at all? After some contradiction in discussions with radiologists, I decided to try to dive into the research at PubMed and answer the questions for myself. I'm hoping you found this interesting and it can help you decipher the information on your MRIs going forward. Now let's start part 3 with a paper called Evaluation of Intervertebral Disc Herniation and Hypermobile Intersegmental Instability in symptomatic adult patients undergoing recumbent and upright MRI of the cervical or lumbosacral spines. That is a really long title. The paper was by Ferrero Perez et al. And Ferrero really needs to work on shortening up that title. Okay, so why they did it. The authors had the same question in mind when they went about this study as I've had. They wanted to simply figure out the difference between MRIs done lying down and those done when in the seated position. Now, how did they do it? Well, 89 patients were studied. 45 of them had their low back imaged, while 44 patients had their necks imaged. The images were done in both the lying down position as well as the seated. Now, here's what they found. The overall combined recumbent or lying down miss rate in cases of pathology was 15%. Overall combined recumbent underestimation rate in cases of pathology was about 62%. That's pretty big. Overall combined upright seated underestimation in cases of pathology was 16%. So to wrap it up, what they're saying is upright seated MRIs were seen to be superior to recumbent MRIs in 52 of the patients studied for conditions of posterior disc herniation and spondylolisthesis. Recumbent or lying down MRIs were only superior in about 12% of the patients. So that's pretty clear cut. The second paper we'll cover in this video is called The Effect of Intervertebral Disc Degeneration on Spinal Stenosis During Magnetic Resonance Imaging with Axial Loading. The paper was done by Ahn et al. And here's why they did it. They wanted to determine if disc degeneration will increase the severity of spinal stenosis when the spine is loaded with axial pressure or from top to bottom. And here's how they did it. 51 patients having symptoms of neurogenic intermittent claudication and or sciatica had MRI imaging loaded as well as non-loaded. All foramen and the spinal canal that neurologic structures will run through, they were all measured for changes in size. And what they found, more accurate diagnosis of stenosis can be achieved using MR imaging with axial loading, especially if grade 2 to 4 disc degeneration is present. Now let's wrap it up. Seated or loaded MRIs are superior for diagnostic purposes. And the last study we'll look at this week is called Dynamic Effects on the Lumbar Spinal Canal, Axially Loaded CT, myelography, and MRI in patients with sciatica and or neurogenic claudication. It's by Willen et al. And here's why they did it. The authors did this one for the same reason as the others. They wanted to find out if the seated MRIs can give us more accurate diagnostic information in regards to those suffering neurologic symptoms that result from disc herniations. Now here's how they did it. 50 subjects were imaged with a CT. 34 were imaged through MRI. The imaging was performed while they were lying down as well as when they were lying down but had an axial load applied. Measurements of the anatomy were made to be able to distinguish any differences the loading may bring about. Now here's what they found. Axial loading of the lumbar spine in computed tomographic scanning, or CTs, easy for me to say, and MRI is recommended in patients with sciatica or neurogenic claudication, when the dural sac cross-sectional area at any dislocation is below 130 millimeters squared. In conventional psoas relaxed position, and when there is a suspected narrowing of the dural sac or the nerve roots, especially in ventrolateral part of the spinal canal in psoas relaxed positioning. Now, what the heck does that mean? Okay, let's wrap it up. The value of the diagnostic information is significantly greater when the subject has an axial load applied during the imaging process. That's all that means. So by now, it's very clear that the seated MRI is more valuable in regards to the information you can get. Now we got one more part to go. Don't miss part 4 next week when we conclude the series. Thanks so much for watching. Be sure to share our videos with someone that you think is going to find them helpful. We'd greatly appreciate your help spreading the word. Be sure to subscribe to our channel. Find us all over social media like Facebook, Google+, Pinterest, Twitter, and Instagram, as well as websites. Our first website is creekstonecare.com, and our other main website is AmarilloChiropractor.com. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Thanks for watching.